gentlemen. This is a story that came out July 19th, 2018 on CBS News. More Americans are drinking themselves to death, study suggests. The Great Recession continues to take a grim toll. Since 2009, a growing number of Americans have died from liver disease and liver cancer. The increase among 25 to 34-year-olds, especially troubling because the deaths are due to cirrhosis, a disease caused by excessive drinking. The authors of a new study said the researchers suspect the economy downturn in 2008 prompted people to comfort themselves with alcohol. These deaths of despair, said leading researcher Dr. Elliot Tapper, an assistant professor. Okay, so I'm just going to go down a little bit. It is similar to overdose deaths from the opioid plague. In both cases, people are trying to relieve the emotional pain they feel, Tapper said. He cautioned, however, that because this is an observatorial study, it cannot prove cause and effect. Cirrhosis scars the liver and causes damage that can lead to deadly conditions such as liver cancer and liver failure. The most common causes of cirrhosis are drinking too much over many years, hepatitis C, or a buildup of excess fat in the liver, known as fatty liver disease, the study author noted. While young people are dying from alcohol-related cirrhosis, older people are dying from liver cancer and non-alcoholic fatty liver disease, Tapper explained. The conditions affecting older people are most likely due to obesity epidemic. There you go. He suggested in many cases, liver disease can be prevented by living a healthy lifestyle. If cirrhosis is caught early, the liver will repair itself, Tapper said, and losing weight can reverse fatty liver disease. Dr. Raymond Chung is director of the Hematology and Liver Center at Massachusetts General Hospital in Boston. Okay, so they're saying that now, on top of the opioid plague, now there is a very young population of adults that are dying from liver disease. And these are 25 to 35-year-olds. That's really interesting. Now, just looking at this article, this does not seem like it just started happening. This seems like it's been going on for quite some time. And they're just talking about it now. That's the impression that I'm getting, just looking at this. For the study, Tapper's team reviewed death certificates data for nearly 600,000 U.S. adults. Between 1999 and 2016, deaths from cirrhosis increased 65%. That's a hell of an increase. From 20,600 in 1999 to nearly 34,200 in 2016. Deaths from liver cancer doubled during the same time period. Compared with women, men had nearly twice as many deaths from cirrhosis and almost 4 times as many from liver cancer, the study author said. From 2009 to 2016, people aged 25 to 34 had the highest annual increase in cirrhosis death. Wow, that is a young crowd of people right there. Nearly 11% deaths from liver cancer among those under 55. Meanwhile, decrease, but rose among people over 55, Tapper said. The greatest increase in deaths from cirrhosis was seen among whites, Native Americans, and Hispanics. Very interesting. Deaths from cirrhosis and liver cancer rose fastest in West and Southern states. For example, deaths in Kentucky rose nearly 7%, in New Mexico, 6%, and in Arkansas, nearly 6%. Only one state, Maryland, saw a significant decrease in cirrhosis deaths of about 1%, the findings showed. According to Dr. David Bernstein, chief of hematology at Northwell Health in Manhasset, New York, this study highlights the silent epidemic of advanced liver disease in the United States, which largely remains unrecognized and unacknowledged by the collective medical leadership. Bernstein added that the paper should be a wake-up call to the medical community and especially to healthcare policymakers and administrators that we need to focus on disease prevention and risk factor modification, while at the same time shifting resources to address the already growing burden of cirrhosis and liver cancer. That is deep. That is really deep. What's going on here? A report from the U.S. Center for Disease Control and Prevention released earlier this week echoed these findings. Between 2000 and 2016, liver cancer deaths were up 43% for men and 40% for women aged 25 and older, the CDC reported. So there you have it. And Loretta decided to join me on this video. You want to add something, girl? Okay. So this is another plague, y'all. Liver disease and liver cancer is at epidemic levels between whites, Native Americans, and Hispanics ages 25 to 34. This is just wild what's going on. I mean, it's not funny, but it's just so much going on at one time that is just really stunning of what's going, I'm just shocked to even come across an article like this. But like I said, in order for this to be as widespread as it is, this is not new. It's just coming to the forefront for the first time. But tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I will see you on the next video. And if you can support my channel, please do. Peace, family.